Hi, Kat Tunney from CBC. Kind of to zoom out a bit, you have asked Prime Minister Justin Trudeau to basically stay in his lane when it comes to jurisdiction. Why should Canadians care about jurisdiction when it comes to services that they can benefit from?
Well, look, I mean, I can tell you we have had 112 court cases over the years where the courts have told provincial governments they have to stay out of federal jurisdiction. And we haven't had to have a case, I think, since the 1950s as a result. And so we are wanting to draw some clear jurisdictional boundaries, because part of the reason, especially when it comes to social programs, that we have the approach that we do, where they're designed at the provincial level and funded at the federal level, is so you don't have duplication of administration. One of the things that we do know is that one of the biggest costs of delivering a social program is developing the infrastructure, the bureaucracy, and the payment system to do that. And so when the federal government announces programs that are duplication, whether it's dental, whether it's long-term care, whether it's pharmacare, whether it's school lunch programs, then you're paying for twice as many civil servants to deliver the program, which means you're not getting the dollars down to the people who need them. So what we have advocated is work with us. If you want to get involved in assisting us in cost sharing, then use our architecture and provide funding so that we can expand the program. That's the approach that we're going to be taking on all of these programs that they announce. Did you have a comment you wanted to make?
That's good.
My follow-up, since I have you both, I want to ask about the RCMP, since both of your provinces have contract policing. I'm sure you saw the letter that Minister LeBlanc wrote, kind of outlining Ottawa's vision for the RCMP going forward. Just wondering if you have any concerns, are you comforted at all by Ottawa's kind of vision going forward with contract policing?
Look, we've taken an approach in our province that we have we want to support our municipalities in whatever type of policing makes sense for them. So in some communities, it's peace officers. Some have municipal police forces. Others are working in a regional way. Others are being policed by sheriffs. And still others have RCMP. And we're going to continue to support our municipalities to make sure that they have the approach that's right for them. Unfortunately, we pay for 1,911 RCMP officers, and we have over 400 vacancies. And so we just simply can't allow for those holes to go unfilled, and it's part of the reason why we've been bringing in new sheriff's detachments and new sheriff duties, and also supporting our municipalities and expanding municipal forces, just so that we make sure that public safety is number one.
Our issue is identical to Alberta's, unsurprisingly. You know, we have the same policing model. We have a major municipality that is going through a transition from the RCMP to a municipal force. And part of the public safety reason for compelling the municipality to complete that transition was the fact that we're short RCMP officers in British Columbia. And their desire to go back to the RCMP and the collapse of their municipal force would have resulted in a serious public safety issue. That's how tight things are for RCMP officers in British Columbia. We increased funding for police across the province. We've got the money to pay for the officers. We just don't have the officers. So I'm happy to have the federal government confirm that they're continuing with contract policing, that they're going to take on that responsibility, they're going to do that work. We need that to manifest in RCMP officers trained, deployed to British Columbia, filling those vacancies, ensuring public safety for British Columbians. It's a very basic part of that role.
Premiers, can you answer the question in regards to the privatization of healthcare, whether or not your two provinces and in your discussions with other premiers see that increased privatization is perhaps the solution to dealing with the issues that we are facing right now, whether it comes to ER times, family doctors, specialties, like, has that been discussed? There was a big rally earlier today against more privatization, and where do the two of you stand? Do you believe that more privatization, and in what areas is the solution?
Well, look, I think we have to make sure we're talking about the same thing. We are committed to making sure no one pays out of pocket for hospital services or to visit a family doctor. Those are two principles that are enshrined in the Canada Health Act. So that's the starting point. Who delivers that publicly funded service, I suppose, is a different question. And what we are trying to do in Alberta is allow for more participants to be able to get publicly funded services. It's part of the reason why we're adding nurse practitioners to be able to set up their own private practices so they can bill the province directly so that they can treat more patients. It's part of the reason why we're negotiating with the pharmacists so that they can expand their scope of practice with primary care and do more dispensing so that they're also able to publicly bill our system. We also have charter surgical centres where publicly funded cataract surgeries, publicly funded joint surgeries can be done so that we can specialize and provide more options so that we can clear up waiting lists. But we're committed to the principles of the Canada Health Act. We just think that there can be more providers so that they can specialize and provide better service.
Thanks, Danielle. In British Columbia, we've added just over 300,000 people in the last 2 years to our province. That's well in excess of 10,000 people a month. These folks all need medical support. The big challenge that we're facing in British Columbia is a shortage of healthcare professionals. And one of the anxieties I have about increasing privatization in British Columbia is that having companies that will pay higher salaries for these medical professionals will be in direct competition with the province of BC for our public facilities. We have turned to the private sector on occasion to assist with backlogs. For example, with increased demand of an aging and growing population for cancer care, we've turned to a clinic in Bellingham. These are American doctors. It doesn't take resources away from British Columbians in British Columbia to have people visit that clinic and get that cancer care. So where it's possible to actually expand services available, it's something we're absolutely willing to look at. The challenge, though, that we face is with a shortage of healthcare professionals, if we're suddenly competing with the private sector, it's going to be paying higher salaries, then we have to pay higher salaries too, and then costs go up without the level of care going up in the province. And so we're keeping a watchful eye on that and really focusing on recruitment, retention, and recognizing the credentials of internationally trained healthcare workers to deal with our healthcare crisis rather than looking to privatization as the solution.
To both premiers, please, but perhaps Premier Smith first. Your government has said that it will opt out of dental care. It's considering opting out of the pharmacare program. I'd like to know, in terms of opting out, which is a possible option, how would the federal government and how would the Canadian public know that if you opt out and you still want the funds to put in those programs in your own jurisdiction, how do we know that there will be a level of accountability from your government to ensure that those services are getting to Albertans?
Well, look, I mean, the language that we're using of opt-out is to send a signal to the federal government that we would like them to fund our program. And if they're not happy with our approach, then I guess they'll continue operating a parallel program. But I don't think that that's good for patients because I think it's created confusion. In Alberta, for instance, on the two programs you mentioned, we've had a publicly funded dental program since 1973. We have 500,000 people on it. And when we did our assessment of the federal program, if we collapsed our program and just went to theirs, 100,000 people would have been uncovered because we cover those who are vulnerable on AISH and those who are children of those who are vulnerable as well. We are not going to create a program. We're not going to opt out of our own program or cancel our own program if it leaves people uncovered. So that's why we're frustrated that they didn't come to us first and work with us to expand to different categories of patients. That's what we're trying to do, is they're saying, let's take this 2-year period and let's see if we can get that right. On pharmacare, it's the same thing. Like, I can't go to the people who are covered under our pharmacare plan, which offers 5,000 drugs, and say, okay, we're collapsing our program, and now you can have a 2-drug plan by the federal government. That's not appropriate either. What we want them to do is to come to us so that we can maintain our 5,000 drug program and just expand it to more people. So that's where we're hoping the negotiations will go with the federal government. We want people to be covered. We want to, especially the most vulnerable and those who are at the low end of the income scale. And it would have been far better rather than them create an architecture and a whole separate system with all that administration, if they just collaborated with us first. We recognize that every province is at a different state of development of those programs, and that's fine. But you can't just put a one-size-fits-all program across the entire country, especially when we're so far advanced on these two programs ourselves. I don't know if you have anything. Okay.
Heidi Petracek with Global National. Thank you for being available, Premiers. Premier Smith, I do want to circle back on the healthcare discussion a bit, only because there are people outside who are concerned when they hear provinces bringing up issues over jurisdiction with healthcare decision-making. They worry that means Ottawa and provinces can't work together and nothing's going to get solved, basically. So how can you reassure people who hear that kind of talk that there is a partnership moving forward to solve some of these issues in healthcare?
We come to the table as a willing partner, and I think the proof in that is that we signed a 10-year agreement with the federal government that committed them to spend $22 billion additional dollars. Plus, we came to an agreement on 4 side deals where we identified 4 priority areas that we wanted to support and deliver together. The thing that's confusing for us is they know how to do this because they've done that before. Why are they doing something different when it comes to long-term care, dental care, and pharmacare? We just would like them to use the process that is tried and true that has always worked, where we come to the table, we negotiate, we develop the side agreements, and then we develop some metrics to demonstrate that we're going to achieve them together. I think if they did that on more issues, they would end up finding that they're able to achieve their targets and have the dollars go further. So that's what we're hoping that they will do with these other programs, is to make sure that they're working with us so that we have a single administrator. And that's one of the principles of the Canada Health Act, is to have a single administrator. They're actually creating duplication. And so we think that they would be better off working with us under the traditional way.
What's the odds of that happening?
Well, Quebec has had a lot of success in doing these kinds of things where they say, you know what, we're opting out, but we'll take the money. And we think if it's good, if it works for Quebec, it should be able to work for us as well. I mean, everyone has an interest in making sure that patients are covered. I think if everybody comes to the table with that kind of goodwill, we'll be able to achieve what we hope to.